Good evening, everybody. It's an absolute pleasure to be here to talk to you about a project that we are just kicking off, that Oracle and Northwest Cancer Research have funded. And before I talk about the project, I just want to say how particularly delighted I am to have funding to be able to look at inequalities across the head and neck cancer pathway. In my career as a cancer epidemiologist, I've done a lot of research with big data sets, and I've looked at cancer inequalities, but I've done very little on inequalities in head and neck cancer because there just wasn't funding there to do that work. And the other part of my research life, I've actually done quite a lot of research in experiences and quality of life and what it's like to live with head and neck cancer. So for me, this project is another happy marriage because it brings together my interests in head and neck cancer and my interests in cancer inequalities. So for me, this is a project that I feel very passionate about. So I'm co-leading this project with a number of colleagues. One of them, Laura Woods, is another cancer epidemiologist with expertise in cancer inequalities, and she works with me in Newcastle. And James O'Hara is one of our local head and neck cancer surgeons. And then we have some colleagues from the London School of Hygiene and Tropical Medicine with expertise in methods, and from the University of Napoli. And actually we also are working with a head and neck cancer PPI group who are based in Sunderland. So apologies for the size of the font on here. I thought, since I was talking about health inequalities, it might be worth taking a look at what NHS England says or what are health inequalities. And they emphasise they're about unfair and avoidable differences in health across the population and between different groups within society. And for me, it's very important that we look at these inequalities as something that are unfair and unavoidable. Now, to do research in inequalities, you can look at variations by a range of different things. You can look at whether older and younger patients have different experiences or do differently after a cancer diagnosis, or you can look at gender or sex and whether these things vary, or you could look at ethnic group. What we're going to look at in our project is we're going to look at variations and inequalities that are related to the areas that people live in. And what we're going to focus on is looking at both the regions in which people live and also focusing much more on the level of deprivation in the small areas that people live in. So why are we doing this study? Well, there are some studies of inequalities in occurrence and outcomes of head and neck cancer according to where people live. But unfortunately, most of the data is out of date. The data is often only for just parts of the country, so it might be for one area, the area covered by one specialist hospital, for example, or it might just be for specific types of head and neck cancer. So we don't know what the big picture is, and we don't know what the contemporary picture is. We don't yet have data to know about the impact of the COVID-19 related disruptions. I mean, it's likely inequalities will have widened, but it will be good to look at that properly. And actually, we've been talking a lot about how there's limited awareness of head and neck cancer generally. I think the thing that always surprises me as somebody who's interested in inequalities from a research perspective is that even talking to health professionals who work in head and neck cancer, many of them are unaware of the compelling data on inequalities in head and neck cancer. And if you don't know about these inequalities, then it inhibits action to address them. And we also don't understand why deprivation in the area where you live is linked to survival, how long you live after head and neck cancer. We just don't understand why that is. So what we're going to do in this project is three things. We're going to produce up-to-date data on inequalities in head and neck cancer by levels of deprivation and by region, right across the head and neck cancer pathway. So I'll tell you what we're going to look at in a moment. And we're going to look at data for the years before the pandemic and, assuming that we can get it out of NHS England, data for during the pandemic and after the pandemic. And then we're going to use advanced statistical methods to try and investigate how and why deprivation is linked to survival. And then we're going to do a bit of work at the end about developing recommendations for next step. So what are we going to use here is, Vin's been talking to you very compellingly about some of the data deserts we've had. One of the things we are fortunate to have is a national cancer registration database in England, and not every country in Europe has national cancer registration. And what happens in hospitals up and down the country is that all newly diagnosed cancer patients are registered on this database. And it includes details about the patient, so their age and their sex and their postcode, etc. And it also includes details about their cancer, so when it was diagnosed and where in the head and neck it was diagnosed. And this is the core of the data that we're going to use. And then this can be linked by NHS England to all kinds of other data sets and produce a really valuable resource. So they've got data on the routes that people follow to diagnosis. Were they diagnosed as an emergency? Did they come through urgent cancer referrals, known as 2-week wait, or a standard GP referral? There's information on cancer waiting times, which we often see reported in the newspaper. There's information on whether people have had systemic anti-cancer therapies, so chemotherapy. We know about whether they've had radiotherapy. And then this register is also linked to national death records, and that means we can follow people up over time and find out how long they've survived after a cancer diagnosis and what they've died of if they've died. So for the first part of our study, we're going to look across the pathway, and we've said, just for ease, that this pathway is essentially about how they got to their diagnosis, the actual diagnosis, what type of cancer it was, what stage of disease it was, what happened in terms of treatment, and what happened in terms of survival. And we're going to look at inequalities right across that, according to region within England, and according to the deprivation level of the area in which people lived at the time they were diagnosed. And at the end of all of that work, we're going to produce an open access online resource with summary results. So if anybody wants to have this data at their fingertips, they can look it up. So if somebody's thinking, so I'm based in the Northeast, and if somebody's thinking, well, what does head and neck cancer look like in the Northeast? They can go to this resource and look it up and compare the Northeast with London, for example. In the second part of the study, we're going to try and understand a bit more about why there's a link between where people live in terms of the area being more or less deprived and survival. Now, I don't want to bore you with this, but the methods that we've used traditionally in the past to look at these types of research questions are potentially misleading. And there have been developments in the world of statistics, and we've now got more sophisticated methods to look at these research questions. So what we'll be able to do, we hope, is try and unpick things about, are these inequalities because people from different areas are more or less likely to be diagnosed as an emergency, or to be referred to hospital through 2-week wait, or to have more advanced cancers, or have other conditions that impact on their chances of getting cancer treatment, or does it take longer for their treatment to get started, or are they less likely to have active cancer-directed treatments? And if we can put all of this together with these advanced statistical methods, it might help us understand a bit more about how all of these things are linked. And if, for example, we were to find that the association between deprivation and survival is all down to stage, then that would tell us that where action needs to be taken is a roundabout stage at diagnosis. Then the final thing we're going to do is hold a couple of workshops with head and neck cancer stakeholders. So that might will include charity and PPI representatives. We'll get health professionals in there, cancer alliances or integrated care boards, and probably researchers. And what we want to do is work together in those workshops to develop recommendations for the next step in terms of policy, practice, and in terms of research. So watch this space.